The following program is brought to you by Naleo TV, the people's platform. This program is freely available to the public, thanks to the generous funding from Hui Pohala and the Hawaii Department of Human Services, MedQuest Division.
Walina Mai Kako. Welcome to another episode of Let's Talk Healthcare Hawaii, where we help our community understand important healthcare options that can improve quality of life. In our last episode, we focused on the benefits of having a palliative care team advocate, which led to better health, improved emotional well-being, and stronger family support. We identified that by having a palliative care advocate, patients and their families received guidance and support they needed early to reduce trips to the hospital and enjoy a better quality of life with less pain and more time doing the things they love. Did you know that many of our loved ones living with serious illness like cancer, heart failure, COPD, or kidney disease end up making costly trips to the hospital that could have been prevented? That's where palliative care can truly make a difference. Palliative care focuses on keeping people comfortable, supported, and cared for before a health crisis happens. On today's episode of Let's Talk Healthcare Hawaii, we will explore how does palliative care reduce costly trips to the hospital. With the launch of a new palliative care benefit by MedQuest, providing all Medicaid members across Hawaii to receive this specialized care as an included benefit will be a game changer. This benefit empowers patients to stand up and access the quality healthcare they deserve while reducing unnecessary hospital visits. Any person living with a serious illness who is also a MedQuest member receiving their medical insurance coverage from any of the following: Ohana Care, Aloha Care, United Healthcare, HMSA, and Kaiser are encouraged to ask their healthcare provider to refer them to this program. I'm excited to welcome Angelina Rushton and Crystal Kramer from United Healthcare to help us better understand the positive impact palliative care has already had on many of their members. Aloha, welcome. Thank you so much. It is so special to have both of you on. You know, for our audience that's watching, I'd really love to get them to know who you are. So welcome, Angelina, and welcome, Crystal.
Thank you.
Angelina, can you tell us a little bit about yourself?
Sure. Well, first of all, thank you, Lani, for the opportunity for Crystal and I to be here today to share our wonderful experience with our palliative care pilot program with Hawaii Care Choices. But first of all, again, I'm Angelina Rushton. I'm a registered nurse. I am a Hilo graduate. I came from the Philippines, and but I stayed in this island since I came in 1988, and I'm currently living in Hawaii in Paradise Park.
Awesome.
Yeah, and I've been with United Healthcare for 14 and a half years.
Can you tell us a little bit about what you do there?
Oh, I'm the Health Services Director for United Healthcare. I cover the health coordination service activities for the neighbor islands, so the islands of Lanai, Molokai, Maui, and the Hawaii Island.
Wow. Okay. Thank you so much.
Thank you.
Angelina. And for you, Crystal, tell us a little bit about you.
Hi, Lonnie. Thank you so much for having us today. I'm Crystal Kramer. I'm also a registered nurse born and raised here in Hawaii, and I am a United Healthcare Health Coordination Manager here in Hilo. I've worked for United Healthcare for 8 years.
Awesome. Can you tell us a little bit about what you do? What does your position do?
So we manage health coordination teams here in Hawaii, or here in Hilo, Hawaii. I manage one of 2 teams, and I have 10 people on my team that consists of registered nurses and community health worker. But we go out into the community and we provide services to our United Healthcare Medicaid members.
So of the 10 people that you have on your team, how many members do they serve?
About 400 members.
Wow.
Mhm.
And is that only on Hawaii Island or is it across the state?
East Hawaii of this side of the island.
Yeah, so just only
Yeah.
one team. We have two teams on the East Hawaii side of
Yeah,
the
that's
island.
one of two teams here in Hilo.
Oh,
Yeah.
share with us how many are on the other team and how many people do they serve?
Oh,
They serve about the same amount of people, and there are also 10 people on that team. They consist of registered nurses and social worker.
workers.
Mhm.
We also have another team in Kona, so they cover West Hawaii. So the presence of United Healthcare Health Coordination Team is throughout the island of the Hawaii Island.
Wow, that's really impressive. You folks have so many members. Well, I received some questions from our viewers, and so I just wanted to jump right into it. Thank you so much for letting
Yeah.
us know a little bit about
Thank you
your
for having
background.
us.
So the first question is, why is palliative care important for families here in Hawaii?
Well, I can take that question.
Okay.
Well, thank you. Well, I'm so glad you asked that because this is actually an opportunity for us to highlight our partnership with Hawaii Care Choices. So United Healthcare started a UHC palliative care pilot program with Hawaii Care Choices. We started in the beginning of 2020.
2020.
Yeah, so we're not new to palliative care. So what we've learned through this pilot project is that this program does not only help the members that's served by the program, but the family members and the loved ones that's important to our members.
Yeah.
So what it means is that palliative care is another set of professionals and experts that's part of that becomes part of the members' team.
It's an interdisciplinary
Yes,
team.
There you go.
Yes.
Yeah.
That's
Yeah.
great. That's great. You know, for the viewers, can you folks explain what is United Healthcare?
Okay. So United Healthcare. Well, first, I always would like to have the opportunity to share our mission. United Healthcare is our mission is helping people live healthier lives and helping them navigate the health system. United Healthcare is one of the Medicaid medical insurance here in the state of Hawaii. We offer that insurance to, all the islands. So we are in, Molokai, Lanai, Maui, and of course Oahu and the Hawaii Island.
Wow, that's great.
We have our dual plan and our Medicare plan as well. Here
Okay,
in
so
Hawaii.
if people either would like to sign up for United Healthcare or they'd like to switch to United Healthcare, we'll go ahead and provide the number at the bottom of the screen so people can call to inquire about more information. I just wanted them to understand what United Healthcare actually is and what it does as well. So my next question is, what services does a patient receive if they sign up for palliative care?
Sure, I can answer that. So when you sign up for palliative care, like I had previously mentioned, you get 24/7 support from your interdisciplinary team, which consists of a registered nurse, a chaplain, and a social worker. And these are all very crucial supports to have, especially in a time of need. We have had so much success, especially with the palliative care RN, even attending visits to the providers with our members on palliative care. And that just makes them feel so much more supported.
Yeah. And the other thing I would like to add that I think is pretty unique for palliative care, again, based on our pilot program with Hawaii Care Choices, is the education and empowerment that the palliative care team provided to our members and their family. I think if we have to sum up the benefit is the knowledge that they provided our members and their caregivers on how to manage their own symptoms. So instead of, again, relying on calling 911 for emergencies, the palliative care team, besides their availability, they're taught our members on, okay, if this happens, this is what you need to do.
Yeah.
If you're feeling this way, these are the things you can do to decrease those symptoms. So
Yeah.
again, the empowerment and education is, I think, is the critical. If I have to put that in a, to summarize.
And Angelina,
Yeah.
you have said that you can't put a price on that kind of education, and I
Yeah.
agree.
Yeah.
So would you
100%.
say that that education and empowerment is unique to this particular program?
I would say because it's very specific to the member's chronic condition.
Mhm.
Yeah,
Mhm.
and the education that's provided is not limited. It's whatever it will take to manage that symptom at home. It
Mhm.
was provided to our members by Hawaii Care Choices.
Yeah.
So I understand about the pain symptoms, sometimes, or that might be the most important symptom to manage. But do you folks come across the emotional symptoms that patients deal with? Can you tell me a little bit about that? How the program has actually addressed those who are maybe dealing with anxiety or depression?
Sure. Well, like I had mentioned, they have a chaplain available for support and a social worker. And those parts of the team can help link that member with other community resources to help them cope with those different emotions that they're going through. And we do have several resources here available in Hilo and even support groups for our
So where
members.
is everybody getting their care? Are they getting it at home?
They are.
Wow.
Yeah.
So
So,
convenient.
yeah, and one
Yeah.
of the things I wanted to add on I would say pain management is that sometimes when we hear pain, we think of medication.
Mhm.
Mhm, mhm.
But a lot of the pain that we've seen on our members was relieved by not medication, but more for like what Crystal mentioned is addressing some of those, health is not just the physical health,
Mhm,
but the emotional and the spiritual needs of individuals. And
mhm.
believe it or not, once you address some of those needs, the body follows.
Mhm.
And that's what we've seen with our partnership with Hawaii Care Choices, the palliative care team during this pilot that was effective. And now it's a benefit
Mhm,
where
mhm.
it's palliative care benefit is now available throughout the state.
Oh my goodness, that's so exciting. Can you share
Yes.
with us a little bit about that?
Sure. So the palliative care program is a free benefit under the Medicaid plan. So if you are a Medicaid member here in Hawaii, that program is free to you. You need to first, sorry, contact your provider, your primary care provider, and
Uh-huh.
discuss the program and decide amongst the two of you if this is appropriate for you. But a lot of the time if there is question, we ask that the referral does get sent in to the palliative care program to review, because there's so much more that is eligible for this program now than previously. So
That is really wonderful that people are going to have access to this. Let's talk about access. Angelina, what is your feeling about more people having access to this level of care?
Well, thank you for that question because I really wanted to. I describe palliative care as too good to be true program.
Mhm.
It's too good to be true. Again, first of all, it's offered in the setting where the individual chooses, which is if they wanted to receive that care at the comfort of their home, that is palliative care. That's what's unique about palliative care.
Yeah.
And again, a unique, I would say, specialized team, interdisciplinary team that doesn't only address the physical, I would say, physical problems, but the total, being of an individual and focusing on what's important to that person.
Yeah.
So, yeah.
Well, it sounds like this is too good to be
Mhm.
true. Can you tell me, are there any barriers that you folks come across?
So the primary barrier is the misunderstanding between palliative care and hospice care. So with palliative care, the condition actually could be curable. So the member is able to continue any life-sustaining treatment they prefer to, as recommended by their healthcare provider, of course. But there is that misunderstanding in the community and also amongst the providers at times too. So that's what's so great about the palliative care program, and being able to do this is we're able to, change that perspective and
Yeah.
get people to understand what palliative care really is.
Yeah, so, in short, palliative care does not equate to hospice care. Individuals, again, our experience with our members, those who are on palliative care um, could have chronic illness and not necessarily terminal illness, which is what hospice care is. And palliative care is they could continue to receive aggressive treatment, such as chemotherapy if needed, dialysis. So there's no change on their treatment plan. Again, palliative care is that additional support at home to help to help individuals with chronic illness to manage the symptoms instead of going to the emergency room, losing that special time with family members and sometimes pets. We have members where they live alone and they have cats and dogs. And when they call 911 and they get in the hospital, they're like they force themselves to go home prematurely because there's no one to take care of their pets. Now, having a palliative care team with you, especially if you live alone, it will make a big difference because they're there to call them 24/7, and on the phone, they will, or they will do a visit. Also, I forgot to mention that being in the program, the interaction is not limited to telephone calls. The palliative care team do home visits on a regular basis, depending on the needs of our members.
Yeah.
So yeah,
Absolutely.
And
That
go
makes
from
that
there.
makes a lot of sense.
Yeah.
Is there a cost to those who have Medicaid and maybe even those that have Medicare? And maybe in your organization, is there a dual coverage?
Yes, we do have dual coverage. So the benefit of palliative care program is free under the Medicaid program. So if you are a Medicaid member, that is a free program to you should you qualify with your diagnosis.
So they still need to be referred though, right? That
They do.
They can't just assume that, oh, we have it. So
Right.
we don't even need to check in with anyone.
yeah, there are specific clinical criteria that qualifies for the benefit. And the best way for the East Hawaii folks, if they're interested, is by calling Hawaii Care Choices. Hawaii Care Choices is a palliative care provider, under the Medicaid benefit program. And I would say they're the expert in terms of in the community, in our East Hawaii community, that they're the best, I would say, place to get information on the new benefit.
That's
Yes.
great. And
Yes.
what about those with Medicare? How do they
Oh.
fit in this?
Yeah. Well, Hawaii Care Choices has Kupu Care program, which is their own palliative care program. And they, if you don't have Medicaid, all they have to do is call Hawaii Care Choices again and just express their interest on their palliative care program, which is Kupu Care.
That is
Yeah.
awesome. That's really exciting for all of the viewers. Can you tell me, in the years that you folks have been doing this pilot with Hawaii Care Choices, what kind of improvements have you seen in the quality of life for your members?
Sure. So we have seen so much improvement, especially when it comes to being able to take your medications correctly, which has led to an improvement in their overall physical condition. So we've even had members improve so greatly that they've graduated the Kupu Care program, knowing that they can always reapply when needed if they need it in the future. But that's how much improvement this program has brought to some of our members. So we really highly recommend the program, and we see less ER visits, more medication compliance, less pain, more family support. So it's really just an amazing program overall.
So we're very happy that this is now a Medicaid benefit. So this I would say this palliative care is not only limited to our East Hawaii side now; it is statewide. So we're glad that we could, the program could bless many more individuals. So it's just a matter of the community tapping into the benefit.
Yep.
Yeah.
I'm really excited that we're going to now bridge the health equity with regard to more people getting access to such quality care. Angelina, is there any example of maybe one of your patient and families and how being on palliative care affected them?
Yeah. So that you heard a member
Yeah.
story, but what I wanted to share is the collaboration that took place between our health coordination team that are assigned to the members in the program and the palliative care team that's following our members in the community as well.
Yeah.
So for the similar member, we meet with the assigned registered nurse, case manager on a regular basis, and we cover some barriers, some issues or questions related to the medical insurance, if any, or coverage. And we were able to kind of help each other. And they said, hey, this member needs this, but we don't know how to get it and how to get it covered. We need authorization. That's where we come in and say, you know what, we got that part. We'll take care of that. Just tell us what's needed. And then, so we were able to, a particular case was a specific test that needs to be done. So we took that, to help the palliative care team so they don't have to worry about that part of the care of the member. So during this pilot program, that was the what you saw overall, that we need to have that continued collaboration.
Yeah. The referrals go both ways.
Yeah. In order for a successful story to happen. So that's, I just wanted to point that out. Don't want to miss that, because that was one of the big part of this program is that collaboration.
Wow, that's great. Well, we're gonna close out this really valuable and power-packed interview that we're having today. But I wanted to ask, is there one takeaway that each of you might want to add to our show today?
Oh, yes. For the viewers, I would really want our viewers to understand that palliative care is not hospice care, because that's kind of like, I think, the misconception, and that palliative care equates to quality of life.
Awesome.
Yeah.
Awesome.
Increased quality of life. And like I had previously mentioned, for the viewers, it helps so much to have so many people to support you and to help you to navigate your healthcare here in Hawaii. And we highly recommend the palliative care program to our viewers.
Yeah. And these are the people from Hawaii Care Choices. They live in our community. They know our community. They're our neighbors. We go to the same store, right? So these are practically not strangers. So if you're not sure, it doesn't hurt to try.
Exactly.
Ladies, thank you so much for joining me today.
Thank you for having
am
us.
really thankful for all of the great information that you folks shared, and I know that our viewers are just as thankful as well. Thank you again.
Thank
Aloha.
you. Thank
Aloha.
you.
Thank you.
Here are a few takeaways from today's topic. Palliative care teams help manage symptoms early at home by controlling pain, shortness of breath, nausea, or anxiety before they become emergencies. Palliative care helps prevent the need for sudden hospital visits. Palliative care also coordinates care between doctors, specialists, and caregivers. This teamwork keeps everyone on the same page, reducing mistakes or gaps in care that can result in unnecessary hospital stays. Common barriers to receiving palliative care is that many people don't know what palliative care is or think it's only for end of life. Doctors or families may wait too long to ask for palliative care support, so it's important to ask for it early. When these barriers are removed, patients feel more comfortable and in control with less stress about what might happen next. Families feel supported and less overwhelmed knowing that they're not facing serious illness alone. Together, they can focus on quality of life and spend more precious time at home, surrounded by loved ones instead of being in the hospital. Let's discuss palliative care eligibility. For those diagnosed with cancer, congestive heart failure, advanced renal, kidney disease, advanced liver disease, chronic lung disease, also known as COPD. How are these services paid for? Palliative care is covered under most insurance plans, including MedQuest. You may be responsible for a co-payment based on the type of insurance you have, similar to an amount you pay when visiting a specialist. How does one know they need palliative care? Are you or your loved one experiencing symptoms such as frequent pain, nausea, anxiety, shortness of breath, and/or depression? Is your caregiver overwhelmed, tired, and frustrated? Are you visiting the emergency room several times in 60 days? Do you need to call your physician often? If you've answered yes to any of these, then it's time to consider palliative care. Mahalo for tuning in to Let's Talk Healthcare Hawaii as we explored how does palliative care reduce costly trips to the hospital. Mahalo nui to our special guests from United Healthcare, Angelina Rushton and Crystal Kramer, who shared proof that palliative care continues to work for their members. If you are living with a serious illness and would like to receive palliative care, please ask your healthcare provider to refer you as soon as possible. Early care equals more quality time doing what you love and less time in the hospital. By understanding palliative care now, you and your loved ones can make informed choices that lead to greater comfort, peace of mind, and meaningful time together. Mahalo for joining us. This segment will air every Thursday and Sunday at 7 p.m. on Naleo TV Channel 54 for the next 2 months. You can also view this on our Hawaii Care Choices YouTube channel and naleo.tv. Mahalo to our ohana and friends who wish to listen to the audio version of this program by going to our website, clicking on events, then choosing the episode you wish to hear. For more information on this episode or to send a comment or question regarding palliative care, please go to our website at www.hawaiicarechoices.org or call us Monday through Friday during normal business hours at 808-969-1733. I'm your host, Lonnie Weigert, sending you much aloha and good health until we meet again on Let's Talk Healthcare Hawaii. Aloha, ahui ho.
Mahalo to Hui Pohala and MedQuest. Hawaii Care Choices, Brenda S. Ho, CEO. And special guest Angelina Rushton and Crystal Kramer.